Hello, everyone. Thank you for the opportunity to join you, at least virtually today, to talk at the Research Excellence Symposium. I appreciate the invite from Dr. Scott Campbell and the Foundation in order to be here. And I want to start off by first saying thank you to the Academy of Research and to the Foundation for selecting me for induction into the Academy. It's a really great honor and really appreciate it. And it's really humbling to be a member of this group and to have my names alongside many people who I've considered friends and mentors for a long time, or people I've looked up to in my career in research in OT. So to get started here, I will pull up my PowerPoint. Let me see if I can share. Okay. All right. So to get started, one of the things that we discussed for a presentation today is maybe just talking a little bit, reflecting on my career in research and how I started down this path and kind of where I ended up to where I'm at today at this point in my career. So that's what I decided to talk about, was kind of my professional journey in clinical research. And for those of you who I don't know, which there's probably several people since it's out here virtually, I'm the Associate Dean for Research and Professor and Department Chair of Occupational Therapy at University of Missouri. So how did I get started in this career? So like most people in occupational therapy, what brought me to occupational therapy was an interest in clinical work. And I had a personal experience with occupational therapy at 14. I cut off 2 of my fingers with a circular saw. And after some pretty extensive surgery, and a plastic surgeon came to talk to me and my parents and said, I don't believe he'll probably ever really use his hand again. His fingers are mostly going to be cosmetic. And we're going to have to really watch it, because if something changes, we might actually have to take him back off. He goes, but in the meantime, I'm going to send him to an occupational therapist to see what kind of function that they potentially can get back. Didn't know much about occupational therapy at the time, and so went to therapy. And then the first day, my therapist Sarah said, Tim, you continue to work with me. She's like, we'll get you back doing what you wanted to do, which for me was back to baseball and sports. And I was learning to type and, doing other things, 14-year-olds do. I wanted to be able to be active again. And I did. So for 9 months, I went to therapy. My OT continued to advocate for me the entire time with a plastic surgeon. And today I'm able to use my hands. So I knew at that point that that's what I want to do with my life. I wanted to be able to help other people the way that she helped me. And that started me on this career path. So when I showed up at Washington University several years ago to start my OT training, I thought that's what I wanted to do. I was interested in hand rehabilitation and working with people with traumatic hand injuries until my first year in the program, and Dr. Susan Fitzpatrick joined our program that year just to teach neuroscience. And Dr. Fitzpatrick is I believe the CEO or president is her title of the James S. McDonald Foundation here in St. Louis, a scientist herself. And it was the first and only year she ever taught neuroscience. But for those of you who don't know her, she's wonderfully engaging and very passionate about neuroscience and working with people and helping people with neurological injuries. And it really came through in the class. And so I fell in love with neuroscience, fell in love with working with people who had neurological injury and the complexity of it and the challenges that came with that. And so then I started to shift my focus in what I wanted to do with my career. At the same time, I was working with Dr. Leonard Matheson at Washington University, who's a psychologist by training, but he was working in a work rehabilitation center with people who had really high level cognitive loss. They had fairly mild neurological injuries, mild strokes, mild brain injuries. And so their deficits really only manifested in complex IADL activities, like when they try to go back to work or try to manage their finances or take care of their household. Really interesting and complex population. And it was also coinciding with the time when during Operation Iraqi Freedom and Operation Enduring Freedom, and we had combat veterans coming back from the front lines with blast injury, similar patterns of deficits. And it was intriguing to me and also disheartening to me that these people coming back, that we were really in a lot of ways slipping through the cracks, right? So I don't believe I'm showing my slideshow, so I'll do that now. Sorry about that. We're really slipping through the cracks because, the standardized cognitive assessments that, neuropsychology was doing or even OT was doing wasn't really capturing what their deficits were. They would do well on those assessments, so they do poorly in everyday life. Then when it came to rehab, a lot of what we would do in cognitive rehab was focus on like more of a restoration model, like trying to have them practice different cognitive skills and hoping that it would translate out to, what their IADL loss was. And again, that wasn't really working. And I realized right away that part of the reason why we didn't have a lot of evidence in this area is because OTs hadn't really worked in this space a whole lot, like we had for several years, but hadn't really done research and really shown that our approach to engagement activity really would be the best fit for what their deficits were. And then coinciding with all of this is I got really interested in volunteering in AOTA. Dr. Carolyn Baum, who was the program director at Washington University for many years and was when I was there too. She was also president of AOTA at the time. And I came to her and I said, I want to be more involved in AOTA and what's going on in the profession. She encouraged me to run for a student leadership position in ASD. And so I did. And I was the vice chair, and then rep to the RA for 3 years while I was in the OTD program. As part of that role, I was invited as one of a handful of students to attend the AOTA Centennial Visioning Retreat years ago in Maryland. And one of the central themes of that meeting was talking about the need for research in OT, right? How to build evidence and why we needed evidence, but then also talking about our workforce and needing scientists, like people who are willing to do that work. The interesting about this retreat is it really was a retreat center, and we're kind of in the middle of the woods, and so we spent all day together. We ate breakfast, lunch, and dinner together, and then after dinner we hung out at the place together. And so like toward the end of my time there, I was talking to Carolyn and some other people and talking about, the work I was doing with Len and my interests in science and evidence. And Carolyn, I always joke about this, but as she said, Tim, you ask too many questions to do anything but be a scientist. We just need to help you figure out how to pursue that as a career. And she was right. And so we left that retreat and I'm like, what do I do now, right? If I want to be a scientist, how do I go down this path? I was literally weeks away from graduating with my OTD, getting out into the workforce as a clinician, and decided now, okay, if I'm going to pivot and do research training, what does that look like? Washington University School of Medicine had just received its first round of funding for the ICTS within the school. Part of that grant was to start a T32 program, which was a pre-doctoral clinical research training program that was open to any student in the School of Medicine, excuse me, who is pursuing a clinical doctorate. It was a 1-year full-time intensive clinical research training program. I believe it was around 36 credit hours of courses, and then also a full-time placement in a research lab within the school to do mentored research, ideally coming out with some publications and that research experience in order to kind of start down this path of clinical research. So I applied to the T32 program, and the day after I got back from the Centennial Vision Retreat, it was right at the deadline. I was barely had heard that it existed. I was accepted into the program, but in order to do that, I had to withdraw from the OTD program. So again, weeks away from graduating, I had to withdraw, which was fine in order to do this training program. So I can get started full-time coursework, methodology, stats, the whole ethics, the whole 9 yards related to like what would help me set a foundation for a research career. And I was placed in a lab with John Shernansky in psychiatry, who was running Conti Center, which was a NIH-funded center working with people with schizophrenia. At the end of that time, I graduated with my master's of science in clinical investigation. So I was the first one in the cohort to receive that. And then I was able to go back and finish field work in the OTD around the same time. So I actually got my OTD and my master's of science in clinical investigation at the same time. So now it's time to get to work, and I wanted to start my research career. And I knew that my focus would be in neuro rehab and working with people with high-level cognitive loss and really focus on reintegration into the community. I had what they consider non-traditional training in OT, though. Well, the physician science training model has been around for years, which would follow a similar path, although that's more of a PhD training program, or these T32s or other foundation grants that support this mentored pre-doctoral training have been around. It wasn't something that OTs really participated in by and large. So I was fortunate, Dr. Carolyn Baum knew, about this training program I did, gave me a faculty appointment as a clinical faculty track as an instructor in order to kind of start my research career while I was on a clinical track, which would afford me the time and opportunity to continue my training, which I knew that I needed. So when I started, I had no preliminary data. I had never really written a grant. I had 1 or 2 publications at the time. And so I applied again to another ICTS program, which was a K-12 program for junior faculty. But again, I mean, I was really green and really hadn't written a grant like this before. So obviously it wasn't funded, and which you get used to that really quick in a career in research. And a lot of the feedback I got was really direct, which I mean, you get used to that as well too. But I got several comments that said I really wouldn't make it in an NIH model or NIH funding world unless I really start to focus more on mechanisms of injury and how to assess mechanisms. So in particular, for my area of interest, people kept recommending that I go back and learn how to do neuroimaging. But that isn't what I wanted to do. I mean, I only went down this career path because I was interested in clinical research and working with this population and helping people with high-level cognitive loss get back to doing what they want to do. And I knew that if I pursued, this path of learning neuroimaging, that would take me further away from that goal. And so I kind of just decided, and again, had really good support from Dr. Baum and others that said, look, I want to do it this way. And I think I can be successful. And if I'm not, then I will go out and practice. Because this is the whole reason I went down here. And I was very passionate about that. And so I started focusing my research in these 3 areas over the next few years. And these continue to be my primary areas of focus, looking at the development of functional cognitive performance-based assessments, development evaluation of strategy-based interventions to help people with this functional cognitive loss, and then also looking at development evaluation of self-management interventions to help people with multiple chronic conditions, including neurological injury, to live more independently in the community. So this is one of my favorite quotes I keep in my office that said, that there really is no such thing as luck. It's when preparation meets opportunity. And I was very fortunate to have some really good opportunities that came around the time that I started my research career and training. So as I started to form some of my questions in these lines of research, the K-12 core program was started, NIH funded program. This one was for OTs and PTs, and Washington University participated in that. Carolyn was in the leadership of that program, along with several faculty in WashU Physical Therapy, University of Delaware, University of Pittsburgh, and then eventually it expanded out and includes several other schools now as well too. So I applied to the core training program. It's again a K program through NIH, so junior faculty training program, mentor training. And my first submission was not funded, but I got really good feedback and had the opportunity to resubmit, which was great. And then it was funded on the second time I was able to send it in. Since I got that grant until now, I've had consistent NIH funding to support my research. Continued on the K-12 program, K-23, had R03, R01, R44, and last stages for R21. I've kind of run the gamut of NIH funding to support different research questions and different forms of development. I've been very fortunate to do so along the way. I had really great training through the core program and through my K-23 training as well to help support me to do that. My primary outcomes have never been mechanism and never will be. My primary outcomes have always been occupational performance, or looking at increased level of independence, especially in complex IADL activities. Secondary outcomes of any of my research questions have looked at impairment reduction and also looked at mechanisms, including now recently incorporating neuroimaging into my studies. But I'm collaborating with people who have that skill set and can support that aspect of my research program, and looking at mechanistic changes associated with the interventions that we're doing in OT. You learn a lot along the way, right? And I still consider every day to be a learning experience for me in this career. First and foremost, you really have to have thick skin, and you're going to get really, at times, it's going to seem direct feedback is the best way I can put it, and you've got to understand that it's just there to help you grow. If you take it personally, it's really easy to get bogged down and to kind of get paralyzed with that and not be able to move forward. But you have to be able to pivot and continue moving forward with it. You have to be passionate about what you investigate. I mean, that was something that I was fortunate early on to to have that passion. I still have it today, to stay focused on that. And it comes through. Now that I spent a lot of time reviewing grants and I've been on several SRGs, you can read a grant, you can tell when the people who wrote that grant really care about what they're looking at versus they wrote the grant because it was a funding opportunity that they thought they might be competitive for. But you're going to spend so much time in the weeds with your research question. There's going to be a lot of day-to-day, and if you're not passionate about what you're doing, I think it's really easy to get burnout on that. And I'm fortunate to say I don't feel like I've ever felt burnout in pursuing the research questions I have. You have to be willing to fight, and you can't lose sight of what you're fighting for. So I know that's a word that we're not really comfortable with in OT, but it's just part of this process of going out research, that you have to be willing to fight for the people that you're trying to support. You're going to be able to fight for, the research questions you want to pursue in order to build the evidence that you need. And knowing that a big part of what we do in research is advocacy, right? We do these studies in order to build evidence to support our interventions. And then if we need to use that evidence to support our advocacy efforts to go out and try to pursue, with third-party payers or policymakers to say, look, OTs really should be in this space. We really should be the ones working with with this population. And every day, I try to keep several quotes and things in my office. I have things in my office talking about the population of people I work with, the feedback I've gotten, the things they've told us, the ways that the interventions have helped them, things I've heard from clinicians who said, hey, started using this assessment and it really helped, us work with this population. And that really helps me focus. I say this all the time, not just research. I think it's a good lesson in OT in general. You got to celebrate every victory, no matter how small, but you got to celebrate the big ones even more, right? So every time you get a paper published, every time you get a grant scored, right? Every time, you get invited to present to a group, or every time, you hear back from a clinician or a student who says that the research helped them, you got to celebrate that, because that's really what we're doing this for. You're not going to get the immediate feedback that you get from working with patients out in the clinic if you go down this career path, but this is, in a lot of ways, this is just as rewarding, and you need to make sure you celebrate it along the way. You got to celebrate and value the people that you work with too. And, I talked about this here a little bit as well, but, I've been very blessed to work with really great research staff, really great faculty, really great collaborators, students, participants, and it really does bring a lot of joy to what I do every day. And I never really lose sight of that as well, or take that for granted. I think you have to always admit that you're never too old to have mentors and to learn something new. I still have people I consider mentors. I still, consistently am making note of things I feel like I need to learn more about, or seeking learning opportunities. I don't think you ever really finish training. I think it becomes less formal. I think it becomes something that's a little bit more just inherent in kind of what we do, but you're never done training if you're on this career path. You really have to adopt a lifelong learning approach to being an investigator. And you have to get comfortable with being uncomfortable and with change, right? Things change, questions change, data doesn't turn out the way that you want it to, funding mechanisms change, the world changes, right? So now as we're pivoting our research questions to address, after effects of COVID and things that we weren't ever looking at years ago, or now we have to change how we recruit, how we retain participants, in a post-pandemic world. And you just have to kind of lean into that and understand that change is where growth happens. And that's just all part of the game. And the last thing is have fun. Every day I try to make sure that I try to keep things light. I'm known for being somewhat sarcastic. I'm known for having a lot of dry dad jokes. I'm known for things like that around the office, because again, what we're doing is important, and we all work really hard to address these research questions and try to help these populations we work with, and our students and our trainees. But it's also really fun, right? It's really great what we get to do, and I don't ever want to lose sight of that either. My dean always says this every year, at graduation, and then I'm stealing from him. He talks about the importance of having support and working with others, and he quotes the Beatles to say, I got by with a little help from my friends. Research is a team sport, and I think anyone who works in this space will tell you that it really is a team effort. all the time, every day. And we rely on each other. We rely on the people we work in our lab. We rely on other people at the university. We always have mentors and friends and people that we worked with. I try to list them out here, and I know I'm going to fall short. And I didn't want to not name people, but at the same time, like you always do that to your own peril, and that you're going to forget someone. But I wanted to make sure I listed people down here who have been really good friends, mentors, collaborators, colleagues of mine over the years that absolutely no way my research program would be able to advance. No way I would have been able to get to this point in my career without them. I listed Carolyn Baum first, who's been, my program chair, my my pre-doctoral mentor, my postdoctoral mentor, my PhD mentor, junior faculty mentor. Worked side by side with her for years to get to this point. She helped provide a lot of opportunities for me for training and to basically start my research career. So it was really important that I had her first us list. And then the other people on here have all helped, supported, work with me in some way through, either K Award mentors or as co-PIs and co-investigators on work I've done, provided feedback on grants and papers, or just been someone who listened, which is also important. So I want to make sure that I say thank you to all of them, and that I want to make sure they know that I know I wouldn't be in this point right now if it was not for them. And finally, just want to say thank you. I had 2 extra slides in there on an accident. Thank you also family who, have always been supportive of my research career, as well as my wife and my 3 sons, who, again, sometimes have to bear the brunt of the long hours and, the hearing me whine about reviewer 3's comments or something like that. But again, thank you all for listening and for attending this Research Excellence Symposium today. And thank you again to the Foundation, the Academy, for inducting me into the Academy this year. It really is truly a great honor, and I'll always cherish it. Thank you.